Dr. Crockett and Dr. Crocker with Zeal Integrated Health. And today we're going to talk about processes that can affect or lower your thyroid hormone or cause hypothyroidism. I think a lot of patients that are struggling with this, they really struggle with fatigue or energy, having the ability to just get through their day. They have an ability to focus and really think clearly and process things maybe as quickly as they normally would. You also see them struggle in the department of weight loss. They've tried every diet that's out there and they just can't get the weight off.
Yeah.
We'll see it affect the GI tract. They start dealing with constipation. You start seeing hair loss, hair thinning. They start losing the outer part of their eyebrow. These are just the symptoms that probably bring you to a doctor, and the doctor says, yeah, you need to get your thyroid hormones checked. But today I want to talk about some of the processes inside the body that can cause this to occur. And these are things that you always want to get somebody to evaluate whether you're dealing with any of these things. What are some of these processes that you see in the clinic with our clients?
Yeah, many times what we find is that patients will either present with diabetes or they'll present with a thyroid condition and they'll have diabetes with their thyroid condition. Many times diabetes is going to affect the liver. The liver is where you process many of these hormones from T4 into T3 that actually really make the body start to process, makes the metabolism start to move like it's supposed to.
That whole process is very inflammatory, and anytime you have more inflammation in the system, you're going to see that the metabolism starts to slow down, and that means you're going to slow down the production of T3 hormones, T4 hormones in that process.
Yeah, and then that leads into a lot of weight gain. Well, when the weight gain comes, a lot of people get stressed with that. When you get stressed, that actually is going to play a bigger role into either you having more of a thyroid condition or maybe even in exacerbating the diabetes that you have.
And you see stress, whenever you're under a lot of stress, whether it's due to work or life, what's going on at home maybe, it involves adrenal function. And whenever the adrenals do get pushed and get stressed, you ultimately have the risk of running into a low adrenal state that's going to ultimately cause an impairment in T4 and T3 hormones.
Yeah.
So we can see the adrenal function and stress really drive this process in a lot of people as well.
Yeah, and you can even look a little bit farther at the cellular level. You have gene deficiencies that cause things like hemochromatosis that actually goes back after the liver once again. A lot of these things are going to come back to the liver. A lot of these things are going to exacerbate one of these conditions that's going to create more of the problems that you're dealing with. You're going to find that you have more symptoms. You're going to find that these are the things that's going to ail you in your everyday life.
Yeah, and I'd say one of the other things that we see in the clinic is hormone imbalance. You see people with growth hormone deficiencies. You see people with estrogens or testosterones that are off. A lot of times these estrogens may be even from external sources like birth control, and can be impairing somebody's ability to mobilize that thyroid hormone and drive metabolism. So we see a lot of things in the body that drive our health and our metabolism, and that's going to feed back into that thyroid mechanism and really ultimately lead to a low T4 or T3 hormone level in the body. So hopefully this helps you understand what might be causing your low thyroid symptoms. And remember, it's important to get these things checked. So click the subscribe button down below to check out our YouTube channel. And remember, there's a healthy person in each of us.